All right, good afternoon, everyone. One more sound check, okay? Can you guys hear me okay? Yes, perfect. All right. So today we'll cover respiratory system. Also, I posted on the modules some respiratory videos. Okay, there are some YouTube videos that helps to see some of the stuff that we're going to talk about through 3D animations. Okay, most of the videos are like 3 minutes or less. Okay, so they're real quick, they're real easy, very informative. Okay. All right, so the respiratory system does include the nose, the mouth, um, the larynx, trachea, bronchi, and lungs. Okay, so I do want you to know all the different parts that are associated with the lungs. Okay, the PowerPoints are in Canvas. I made sure they were on there, so they should be on Canvas, and they're also on the website. So you should be able to find the respiratory in both spots. Okay, and I don't have any of the videos. Someone asked if I had the videos are the same from the website and Canvas. I don't have any of my personal videos posted on Canvas, although I do have some third-party 3D videos posted. Okay. Okay. The major function of the respiratory system. So keep in mind as you all are studying, anytime you see the word function of, just make your note card. On the front side, you might say the function of the respiratory system is, and then on the back side, you would put what that function is. Okay, things like gas exchange between the air and blood, so a lot of CO2 and oxygen. It also functions to move air in and out of the lungs. It's responsible to help us speak. So we are able to produce sound because of air coming out of the lungs and up through the vocal cords. Okay, smelling also helps us with smell, and it helps us with the regulation of pH, right? So that's potency of hydrogen. Too much hydrogen and you become acidic, not enough and you become too alkaline. So you can hypoventilate, which isn't good, or hyperventilate, which isn't good. So everything's going well. Breathing will help regulate pH. Okay, would like for you to know the difference between the upper respiratory tract areas versus the lower. Okay, so the upper respiratory tract includes these parts here: the nose, the nasal cavity, paranasal sinuses, and the pharynx. Okay, actually, if y'all could give me 1 second. Okay, so sometimes people have an upper respiratory tract infection. Okay, so if you hear that, what does that really mean? Well, you're seeing it here. Those are these parts, okay, that create the upper respiratory tract. Your nasal cavity, which is basically behind the nose area, is designed to help filter the air that you're breathing in. It warms it up. It helps moisten the air. Okay, it also functions as a resonant chamber, right? So in other words, if you ever notice if your nose is real stuffy, like you just sound funny, okay, because the resonance is different, right? So if it's working properly, the resonance kind of has a normal sound for you, and contains olfaction. So our smell nerves, right, are located in the nose area. So it's cranial nerve 1. Okay, the pharynx is the throat area. It allows for the passageway of food and air. So you do find the epiglottis here, right? So the epiglottis, as you're swallowing, closes or protects the windpipe, so you don't get food or water going down the windpipe, and it would route the food or water into the esophagus. Okay, so you have 2 tubes, and the trachea, which is your windpipe, and the esophagus, which is your food tube. And in the pharynx area, this split occurs so that things are either routed into the food or into your food tube or into the trachea. Okay, the lower respiratory tract are all these components here. Okay, the larynx, which is the voice box area, trachea, the bronchi, and bronchioles. Okay, so this gets into the actual lung structure. All right, so the larynx plays a role in speech. Okay, this is located inferior to the pharynx. So the pharynx is like the top part of the throat, and the larynx would be like the bottom part of the throat, where the Adam's apple is found. Okay, that's kind of the lay terms. The official name of it is a thyroid cartilage. Okay, we do have the trachea, which is the actual windpipe that is kept open by hyaline cartilage. Okay, so hyaline cartilage rings keep the trachea open. Okay, the bronchi, so the trachea divides into the bronchi, the right and left primary bronchi. Okay, so the primary bronchi, and then secondary bronchi, and then eventually the tertiary bronchi. It's kind of like a tree, right? You've got one branch that gives rise, it splits into more branches and splits into more branches and so on. Okay, the lungs behave similar. We do find smooth muscle here. Okay, smooth muscle, and that's important because the smooth muscle is what responds to asthma stuff. Okay, so if you have, spasms and you have to do an inhaler, albuterol or whatever, it is important to know we do have muscle, and they can respond and sometimes not in your favor. All right. Then the farther we go out, the more distal we go, you get into the bronchioles. Okay, also has smooth muscle. And at this point, you're moving away from cartilage. All right, so you really don't find any cartilage once you get this far away, so more distal into the lung field. And it does help regulate the amount of airflow. The lungs are innervated by the sympathetic and parasympathetic nervous system. Okay, so sympathetics, an easy way to activate that is start exercising. You're going to have a sympathetic response, such as bronchial dilation, increased blood flow and circulation throughout the lungs, right? Parasympathetic would be your rest and digest response. So everything would be calm, normal breathing. Okay, so here's some of those parts. that we looked at. Okay, so here's the trachea, the primary windpipe. Then it splits into the left and right primary bronchi. Okay, and then that splits again into the secondary, and then they keep splitting into tertiary, and then it just keeps branching out until you get to the terminal ends. Okay. Some areas I want you to know, we have the visceral pleura. Okay, the visceral pleura actually touches the lungs. The visceral pleura is the pleural material that actually touches the lungs. Then you have the parietal pleura, which does not actually touch the lungs, as you can see by the blue outline there. Okay. And then there's a space, right? So that's the pleural space or the pleural cavity that you see right there in the middle. And you do have fluid in there, okay? The fluid is a type of serous fluid. It helps reduce friction. If it gets inflamed, you have pleuritis and excessive fluid buildup in that pleural space area, which can be not good, okay? All right, you have the diaphragm, so the muscle that helps with breathing that the lungs sit on top of. And then also part of the lower respiratory is the alveoli. Okay, these are the actual site where gas exchange occurs. Okay, the actual site where gas exchange occurs. They are made of the simple squamous epithelial tissue, which means they're very thin. Okay, depends on how you interpret this. One cell layer thick. Okay, that means really it's super thin. It's only one cell layer thick. You could also say it's one cell layer thin, right? So it's very, very thin tissue. Okay, remember, gas likes to diffuse easily across thin tissue. If it's super thick, like your stratified stuff, okay, oxygen and other gases don't really get through that stuff very well, okay? Here's that nasal cavity. So now we're looking inside, right? So it's made of 3 concha. All right, so 3 concha. You can see there are 1, 2, and 3. Okay, that increases surface area to allow for the air that you're breathing in to get warmed and all that before it gets into the lung field. Okay, here's the pharynx, and then there's the larynx. Okay, so pharynx is kind of the upper throat area, and the larynx is kind of the lower throat area. All right, we do have a right and left lung. Okay, the right lung has 3 lobes, as you can see there, and the left lung only has 2. Okay, the heart has been removed, but the heart would normally be here, and it does displace the left lung a little bit to the left because of heart location. Okay, the tubes in our body should have a mucosal lining, right? So your nose, your mouth, your trachea, which is a tube, and all the different parts that come with the respiratory system, okay? They must have a mucosal lining. This is important for protection, okay, because it aids in trapping incoming bacteria and other antigens and particles. And the cilia that you find in the trachea, which are hair-like projections, creates a gentle current that moves contaminated mucus away from the lungs. Okay, it moves it away from the lungs, which means it moves it up to the mouth and throat area. Okay. Now, typically, if you're healthy and not fighting anything, you know, as the cilia is moving all this stuff to the throat, you know, you end up swallowing it. You don't even notice it, right? Because it's so minimal. But if you're symptomatic, I mean, we all do it. If you've got a respiratory infection, you kind of, you know, do the whole thing and get a bunch of mucus to come up, and you can even monitor how much are your healing progress by the color of the mucus, right? So that's all from, you know, mucus and the cilia. Okay, smoking does inhibit this action. So the longer you smoke and the more you smoke, the less mucus you produce and the more you damage the cilia. If you end up swallowing the saliva stuff, the mucus stuff, the stomach gastric juices usually take care of the particles and antigens and whatever found in that. Okay, here we are seeing a healthy lung on the left. Okay, so healthy lung, cadaver lung on the left, and then here's a smoker's lung on the right. You also notice here's the heart. Okay, so I have a cross section through the heart. Here's the trachea. Okay, there's a trachea that goes into the primary, the right and left primary bronchi. And then you can see the secondary bronchi there. And eventually it gets out into the alveoli of the lung, okay, the site of actual gas exchange. Okay, and you can see all the scarring and the, you know, the toxic buildup and stuff like that that comes with a, you know, smoker's lung, and especially chronic prolonged smoking. When it's cold outside, that actually changes the mucus viscosity, and, you know, so you start to get the so-called runny nose. Okay, so it doesn't necessarily mean you're sick. It's just, you know, what happens when the mucus gets too cold. The veins that are found in the nose, because it's blood, it helps warm the air, but because they are so superficial, it can also lead to nosebleeds, right? And also because inside of your nasal cavity, the membranes are so thin, you are at risk for infection if you do contaminated fingers to nose or come into contact with someone. For example, if you're doing CPR and you're not protected, you know, your skin, your actual skin is a barrier, right? So if someone touches your arm, you're probably fine because the skin is a pretty good barrier. But once you get inside of stuff like your mucous membranes, like in the nose, that's really thin tissue, so things can pass through very easily, so you risk infection. So you just want to be careful doing fingers to mouth and fingers to nose and eyes without, you know, washing your hands or whatever. Just need to be careful. Okay, the trachea is our windpipe. It is made of hyaline cartilage. Okay, so these cartilaginous C-shaped rings help keep that windpipe open. So even if you grabbed an actual cadaver or human windpipe and squeezed it and you let go, it pops right back open to where it came from. Okay, behind the trachea is the esophagus. That is your food tube. And food travels through that particular tube of smooth muscle through a peristaltic wave, okay, which moves food from point A to point B, right, all the way through the body. Okay, cross section here, you can see the epiglottis, right? So there's the epiglottis. That's the area or the structure that covers the windpipe so that you don't get food into the windpipe. So this is the trachea. Oftentimes choking people, or the reason why people end up choking is because when they're eating, the food is trying to get routed down into the esophagus, which is the food tube. But because they're talking, the epiglottis has to stay open to allow air to pass through, right? So if it's open and you're kind of swallowing at the same time, then you can risk food getting stuck. All right, so you just want to be mindful of while you're eating, you know, chew your food completely, small bites, break it down. After all, digestion begins in the mouth with chemical and mechanical chewing from the teeth and the tongue, okay? So just as far as an eating tip, right, because I do some nutritional counseling with people in my clinic, and one of the things we start with is very, very basic. How the heck do you eat? Gosh, some people like inhale their food. Like, that was a huge hamburger and you got that down in one bite. What the heck? So I was just literally teaching them how to eat, right? Smaller bites, chew your food completely, and then, you know, try not to talk and all that kind of stuff while you're in the actual act of swallowing. Okay. Here's the uvula, right? So that little thing that hangs down the back of your throat. What that helps do is cover the oropharynx. Okay, so this is you know, it is possible to get something up your nose, right, and go down, and it goes down into one of the tubes. So there's a way to, like when you're swallowing, there's some mechanisms in here to help block that just momentarily, so food doesn't actually accidentally get routed in the wrong direction. Okay, sometimes that happens, you know, for whatever reason, and it can, you know, try to go up here, even fluid, and sometimes fluid will come out people's nose just because of weird laughing mechanics, whatever, while they're trying to drink. Okay, here's a superior view where you have the hyaline cartilage keeping the trachea open. Okay, you have a bunch of those rings that go up and down the entire tube there. Okay, this is the lumen, or the opening of the tube. So anytime you have a lumen, that just simply means that that opening part. The blood vessels have a lumen. The trachea has a lumen, so anything that's got a tube in that opening, that's your lumen. Okay. Here's your mucus glands producing that protective layer of mucus. Okay, posterior or behind. So remember, this is a superior view. Okay, and we're answering these questions right here. So posterior, you find the esophagus, the food tube. Okay, the bronchi, you have a right and left main bronchi. You also might see the word for main would be primary. Okay, so those are AKAs of each other. So right and left main bronchi, or the primary bronchi. Okay, it enters into the hilus of the lung. Okay, that's the actual opening right here. Okay, so this is the hilus where the tubes and everything is coming in and out of the lungs. Okay, so that's the hilus area of the lung. Okay, the right primary bronchi is angled different. Okay, so it has a little bit different angle than the left side. And as a result, more often than not, if you're going to get a inhaled foreign object, it will likely go down the the right primary bronchi there, okay, because of the angle. It's just easier for it to slip this way, okay. Now the left side's not exempt. Of course, things can get into the left side, but most of the time, it's going to go into the foreign object will go into the right side. Okay, the apex of the lung is up here. Okay, so this is the apex. And down here would be the base. Okay, and things are not called apex and base because of top and bottom. It has to do with an organ or something coming to a point and something that's more broad and flat. Okay, so things that come to more of a point is an apex, and things that are more broad and flat is a base. Okay, not what's up and what's down. Okay, the respiratory zones are these 4 different parts here.
Here's some information for what is part of the respiratory zone.
Jesus, I'm sorry. Starting from the more proximal and working to distal, you have the respiratory bronchioles, okay, and then the alveolar ducts, alveolar sacs, and alveoli. All right, and here's what they look like. Okay, so here's the lungs. So as you're breathing air in, it would go down the trachea and then into the bronchi and eventually out into the actual respiratory zone, right? So starting with your respiratory bronchioles, okay, because this is the more proximal, right? So as we work this way, we're getting more distal. Okay, so the respiratory bronchioles, and then the alveolar ducts, all right, and alveolar sacs, okay, and then the actual alveoli. And then once we zoom into those, you've got one cell layer thin, right? So easy gas exchange. So there'll be lots of oxygen in here and CO2, okay? Saturating the blood with oxygen and also the blood uptaking the CO2 so you can breathe that out. All right, you have millions of alveoli that do make up the bulk of the lungs. Okay, so the lung is mostly filled with air. Lungs are also soft and spongy, okay, and there is an elastic component to them. The elastic connective tissue gives it the ability to recoil, right? So the lungs are when you breathe in, the lungs expand, and when you breathe out, the lungs go back to where they came from. So you want some sort of elastic component to be there, okay? And so you do find some elastic components within, okay? The framework within the lung is called the stroma. Okay, as you age, you can lose this, okay? So one way to, and that's just a natural course of aging. So one way to fight that is to stay active, right? If you don't use it, you lose it. So that's one reason why seniors or elderly have, they're so sensitive to respiratory problems, is because they start to actually lose some lung tissue function. Okay, it just kind of naturally declines over time. Okay, inside of the lungs, you want blood vessels, right? So on the external surface of the alveoli, they are covered with a cobweb of pulmonary capillaries. Okay, pulmonary capillaries. You want blood vessels, and you want that to be able to exchange gas. Okay, it's done through diffusion. Okay, gases can diffuse easily across membranes. So oxygen will leave the alveolar sacs and go into the blood, and CO2 leaves the blood going into the alveolar sacs that you eventually exhale out. We have a defense system inside inside your lungs. Okay, they are some pretty big Pac-Mans called dust cells, right? So the macrophages are a type of Pac-Man that are in there to help protect you. Okay, so we are constantly breathing in junk. I mean, it's very difficult to be in an area and not breathe in some sort of airborne particles of some sort. Okay, so your body is constantly trying to filter out airborne particles, and your mucus traps it, and then once things do get into the lung field, your built-in Pac-Mans will take care of it. Okay, we have a surfactant that's in there. All right, the surfactant is a type of lubrication. So we have surfactant secreting cells, and it does release a little bit of amount of, let's just say, lubrication, okay, to keep the lungs somewhat lubricated and moist. Now, you don't want too much of it, because then you get excessive fluid buildup, and that's not good. And you don't want too little of it, because then it gets all dried out, right? So having some surfactant is a good thing. You can also see the relationship here with the red blood cells and the pulmonary capillaries and the alveoli. Okay, a really nice place for gas exchange to occur. Mechanisms of breathing, the fancy term, we have inspiration, which is inhale, increasing the volume of the thoracic cavity. Okay, you do use the intercostal muscles and the diaphragm for this. All right, this is under involuntary control via the brain stem. Okay, more specifically the medulla and the pons. Okay, those are located in the brain stem. This is done through neurological involuntary control. Now, it's also a little tricky because this is also skeletal muscle, and you could choose to override the involuntary response here. You can hold your breath if you want, okay? You can hyperventilate or hypoventilate if you want, so you could have conscious control over this, but in general, outside of that, this is involuntary, okay? Accessory muscles would be your sternocleidomastoid and your scalenes. Okay, so these are muscles you would recruit. So they're known as accessory muscles, not considered part of involuntary control. So inspiration is breathing in. Okay. So relaxing the intercostal muscles and the diaphragm. Inter means in between, costal means rib. So these are the muscles in between the ribs. And you are decreasing the volume of the thoracic cavity, okay? The lungs help a little bit because of their recoil ability, because of that elastic connective tissue you find within the stroma of the lungs. Okay, Boyle's law in layman's terms. Okay, so it's, let me say that better. Boyle's law, read as is the volume of gas varies inversely with absolute pressure. Okay, you're like, what? Well, in layman's terms, it means when you breathe in, okay, when you breathe in, you increase lung volume, which results in airflow into the lungs. Okay, we have 4 parts to breathing, 4 parts to respiration. You have actual, the pulmonary part, okay, where air moves in and out of the lungs. Okay, this is what everyone refers to simply as breathing. Like, is the person breathing? And are they just simply moving air in and out of the lungs, right? You can even feel the breath, right? If you get close enough or you feel it. Some people will even take a little mirror, like a 2-inch by 2-inch mirror or whatever, put it over the nose and mouth to see if the mirror will fog up. That would be your so-called pulmonary ventilation. Okay, external respiration is the gas exchange. So on the outside of you, right? So like as you sit there and you look at your nose and your mouth, all around you is oxygen, okay? So you're breathing that in. That external air that's outside of your nose and mouth as we speak, you breathe that in. And then you actually breathe out the CO2 back to that external environment. All right, so that's external respiration. Okay, respiratory gas transport is the oxygen and carbon dioxide, the actual act of transporting them to and from the lungs via the bloodstream. Okay, so your blood is a transportation vehicle for lots and lots of stuff. With the respiratory, it is going to do that with gases. And then you have internal respiration, which is deep inside on a cellular level. Okay, your gas exchange on a cell level between the capillaries and the tissue. You start running, your quads and your legs are going to have a high metabolic demand, or a higher metabolic demand. So therefore, more oxygen is going to be delivered to your legs. Okay, if you started to do a bunch of bicep curls, okay, you're just sitting there, but you're doing bicep curls, then your arms will have a higher metabolic demand. So lots of oxygen, more oxygen will be deposited there than your legs, because at this point, you're not even using your legs because you're just sitting there doing bicep curls. Okay, so this is gas exchange on a cellular level, and it does meet the oxygen supply and demand. The more you work, the more oxygen you need. The less you work, the less you need. Okay, with breathing, the ribs do experience what's called the bucket handle effect. So if you look at the diameter of the rib cage here and then the diameter here, it is, let's just say, skinnier, right? Because when you take a deep breath in, your rib cage actually expands. Okay, the ribs come up and out, the thoracic cage expands, the volume increases, and then when you breathe out or expiration, the rib cage, the ribs go down and in, okay, decreasing the thoracic volume. The muscles that you use are the intercostals, okay? So the external and internal, and internal intercostals. So let me explain that in a second. Okay. All right, so when you breathe, when you inhale, okay, the external intercostals grab the rib below and pull it up. Okay, so going back to your ANP1, origin, insertion, right? So origin is the moving part, insertion is the non-moving part. Well, what the heck do you do when a muscle is attached to the same thing as rib to rib? Well, it's the more movable rib, right? So the top, or the rib will, the way you can look at it is it grabs the bottom rib and pulls it up and out. Okay, so that's what the external intercostals do. And then the diaphragm, okay, the diaphragm moves inferior, okay? So if this is your diaphragm at rest, meaning you're at full exhale, okay, there's your diaphragm. It actually moves inferior as you're breathing in. So the new position of the diaphragm is now, it drops down, okay? And by doing that, you've just increased the volume, right? So now the lung field volume is all of this, okay? And look at how much room we just bought by moving the diaphragm inferior. Lots and lots of space there now, okay? And then when you breathe out, the diaphragm goes superior, it moves back to where it came from, okay, into its like upward position, decreasing the thoracic volume. Accessory muscles for breathing would be the scalenes. Okay, so there's your scalenes. The reason why is because they are connected to the ribs. Okay, as you can see there, the scalenes do have a rib attachment, and so does the sternocleidomastoid. It has a thoracic cage attachment, so it will grab, since it's attached to the rib, it does grab the rib and help pull it up. Okay, so these would be accessory muscles for breathing. Neurological control, kind of teased on it earlier, saying the brainstem, okay, more specifically the medulla and the pons. All right, so the phrenic nerve comes from C3, C4, and C5. Okay, C3, C4, C5 keeps the diaphragm alive. C3, C4, so in other words, cervical, so the nerves that come out of the cervical spine at the level of C3, C4, and C5 keeps the diaphragm alive. Okay, it's kind of an easy way of remembering it. So that's called the phrenic nerve. Okay, the other one is the medulla, right? The medulla will set the rhythm and the pons smoothens it out. Okay, so in other words, you inhale and then at some point you exhale, and then you inhale and then you exhale. That's the medulla, right? The pons tells you to do that about 12 times per minute. So most people breathe around 12 to 15, and this is resting, okay, a resting rate of about 12 to 15 times per minute. If you start exercising, you're definitely going to be breathing heavier, okay? So the medulla, how far you breathe in and how much you exhale, and the pons, how many times you do that in a minute. Okay, normal breathing is called eupnea. Okay, the way the medulla, so the brainstem, communicates to the breathing centers is through the vagus nerve. Okay, so cranial nerve 10. And here's a picture of that here, right? So you have the breathing control centers in the brainstem, pons, and the medulla. And then you have cranial nerve 10, which is the vagus nerve. And then you also have the phrenic nerve. Okay, so the phrenic nerve is from your neck, C3, C4, C5, and the vagus nerve comes out of the brainstem itself. Okay, keep in mind, all those cranial nerves, cranial nerve 1 through 12, come out of the brainstem. Okay. The built-in body chemistry also contributes to breathing. So these are done through your chemoreceptors, right? So the more active, I guess you could say it this way, the more active your chemoreceptors, you know, the more they're going to pick up on changes in your gases, right? So CO2, pH, and oxygen. So if you start running, you're producing a heck of a lot more CO2, which your chemoreceptors pick up on that. So it tells the area to start ticking faster. So you breathe faster. All right, some conditions here. Chronic bronchitis. Okay, that word chronic is not a good thing, and itis is inflammation of. So this is constantly having inflammation of the bronchi, and what ends up happening is the mucosa, or the mucus in your respiratory passage, produces excessive amounts of mucus over time, and this impairs ventilation. Okay, so the pooled mucus will decrease gas exchange. Okay, also this increases the person's chances for infection. And because of the lack of oxygen, they turn blue, or they can turn blue, and they are known as blue bloaters. Okay, emphysema people, this is chronic inflammation that promotes fibrosis of the lungs. So you get a lot of scar tissue that comes in to the lungs, and they start to lose their elastic capabilities. All right, so it becomes harder to breathe because of the scar tissue and the loss of elasticity. And so expiration is impaired or obstructed, or it's harder. Okay, so they're exhausted, okay, because they have to force the air out of their lungs like all day. So imagine blowing out birthday candles, but all day long. Like, you'd be exhausted too, right? And because of them working so hard, they're known as pink puffers, because the skin kind of turns pinkish, reddish color. And this can result in what's called barrel chest. Okay, so barrel chest is where the diameter of the chest from the front and the diameter of your chest from the side, so a lateral view, is about the same. Okay, just like a barrel. Okay, asthmatics. There was a bunch of different types of asthma. I don't really want to get into all the different ones, but you know, you'll get more of that in like pathophysiology. But for now, first of all, know that asthma is sometimes difficult to diagnose. You can grow into it, you can grow out of it. Okay, it can be exercise induced, it can be allergy induced. So, you know, they can be difficult. But the bottom line is asthma, and write this down. Okay, asthma is a narrowing of the respiratory passageway. So the tubes, okay, the tubes go from nice and open and a nice round diameter, and they get much smaller. Okay, so a type of bronchial constriction. And air does not pass very well through really skinny tubes. Okay, so so what'll happen is for treatment, they usually take some sort of albuterol or a steroid of some sort, and it makes it go from bronchial constriction to bronchial dilation, okay, which opens up the air passageways. Okay, you can also get exudate, right? So you can get fluid or mucus and other things to build up, which would also contribute to the more difficult to breathe, okay? Another issue that can hurt the lung field is tuberculosis, okay? And then another one would be pneumonia. Okay, pneumonia is a very common what's called nosocomial infection, which means you went into the hospital with a broken arm and then you walked out with pneumonia. So in other words, you got it while you were you got it because you went to the hospital. So that would be a nosocomial or iatrogenic infection, which means you got it simply by going to the hospital. And pneumonia is a big one. You gotta be real careful of that, especially with elderly or immune compromised people. Okay, another lung condition would be a pneumothorax. A pneumothorax is where you get air built up in the lung areas where you don't want air to be, okay? So in other words, air should be inside the lungs, the alveolar sacs and all that, not outside the lung field. And that's what happens with pneumothorax, is air starts to build up outside the lung field, which actually creates like a deflated balloon, right? So here we have a lung that's nice and open, and then all of a sudden a puncture happens, whether it's from a knife wound, gunshot wound, a broken rib, whatever, can be spontaneous, but it pops, right? That pleural cavity area pops. And so air starts to leak in, okay? So then what happens is the lung goes from nice and open to kind of small and shriveled up and significant decrease, okay? So the lung was this big, right? And then it kind of shriveled like a deflated balloon down to a smaller size. That would be a pneumothorax, okay? You do risk cardiovascular compromise because of that. So these are, you know, very dangerous and deadly. If they're mild enough, it's just wait and watch. You know, they take an x-ray, you can see it on x-ray, and they're like, yeah, you have it, but it's super mild. Really nothing we can do at this time. Let's just wait and watch. Let's see if your body can heal on its own. And sometimes it does. And if it doesn't, then they'll intervene, okay? Okay, so oxygen must bind to, so here's your red blood cell, right? And you've got your hemoglobin, okay, which is HB, right? And oxygen is bound, okay? So all these different areas are oxygen binding sites. So in other words, 4 oxygen bind to 1 hemoglobin, and the hemoglobin connects itself to the red blood cell, and you have millions of these on 1 red blood cell, okay? So as far as oxygen transport, you breathe in the oxygen, it saturates the blood, more specifically the hemoglobin on the red blood cell, and then that is transported throughout your body and delivered to cells that need the oxygen. And so what does that mean? Like every cell, like all your cells need oxygen. No more oxygen, and yeah, you won't survive that. Okay. So we also have, well, the part that of the hemoglobin that actually accepts the oxygen is called oxyhemoglobin. Okay, and to create more, you'll release the hormone erythropoietin, right, the EPO. So if you start training, if you go to altitude or whatever, your body will start to create more. Or if you lose blood, like, ooh, look at that blood loss. Oh, no red blood cells. Oh, oxygen carrying capacity just went down. No problem. I'll release erythropoietin, which goes to the bone marrow, which stimulates the production of red blood cells, which then increases your red blood cell, which means increases your ability to transport oxygen. Okay, your lungs, the respiratory system, also responsible for buffering. So you don't want to be too acidic and you don't want to be too alkaline. So you want the concentration of hydrogen to be nice and balanced around 6.5 to 7.5. Okay, around 6.5 to 7.5. Okay, if you get too acidic, I think it's in here. Yes. Okay, I'll go back to some of those others. But if you get too acidic, it's called respiratory acidosis. Okay, you are retaining too much carbon dioxide. Okay, respiratory alkalosis is you are retaining too much oxygen. Okay, retaining, so an abnormal loss of CO2 or too much oxygen. Okay, so respiratory acidosis versus respiratory alkalosis. Okay, so the body has a bunch of ways to try to help buffer things. So your respiratory system is part of that. Okay. Another part of acid buildup is from the metabolism of your proteins, carbs, and fats. Okay, so you kind of need everything working together. You need the lungs, okay, your respiratory system, you need your kidneys. Those are some major factors in acid-base balances. Okay, CO2 is a byproduct of combustion of cellular metabolism. Okay, and so if you are not breathing properly, right? So let's just say, for example, holding your breath, you're going to get an excessive buildup of CO2. Okay, so pulmonary ventilation, in this case hypoventilation, not breathing enough, will give you too much CO2 buildup. Okay, and this will lead to acidity, respiratory acidity. Okay, don't worry about this. Okay, for buffering systems, okay, I've kind of mentioned it before, but what I want you to know is buffering systems keep a balance in pH. Okay, to keep a balance in pH. So breathing can do it, the bicarbonates, okay, the bicarbonate systems in our body can do it. Okay, don't worry about that. Okay, from this one, this is what I want you to know from this page. Okay, the respiratory system compensates by increasing or decreasing ventilation. Okay, we mentioned that earlier through the chemoreceptors, right? So the changes in pH, oxygen, and CO2. So depending on those levels, the body automatically knows to either increase your breathing or decrease your breathing, okay? The renal system, so these are your kidneys, will work together with the respiratory system by getting rid, so you're going to pee out those hydrogens, right? So that's another way we can get rid of them is through the renal system. Okay, don't worry about that. We've already talked about this, the renal buffering. Okay, oops. And don't worry about that. All right. In general, acidosis is too much hydrogen, right? So working closer to the score of 0. Alkalosis is a decrease in hydrogen concentration, working closer to 14. Keep in mind the body likes to be between 6.5 and 7.5. Okay, that's a nice neutral balance. Okay, metabolic acidosis. Now, oftentimes you see these clinically go hand in hand. If a person has respiratory acidosis, they probably also have metabolic acidosis as well. Or if they have respiratory alkalosis, you can pretty much bet the farm that they're also going to have metabolic alkalosis as well. Okay, so this is where the body itself, right? So metabolic acidosis is where the body starts to accumulate acids. Okay, could be because of excessive diarrhea, so too much loss of fluids and other things that go with that, or renal disease. Okay, the kidneys do not know how to help buffer you, so you become too acidic. Diet and lifestyle have a huge part to do with this. Likewise, metabolic alkalosis, due to an excessive intake of alkaline materials or excessive loss of acid in the urine or through vomiting, okay? So you're just becoming too alkaline. And the closer to 14 that you get, the more dangerous that becomes. Okay, hyperventilation is simply breathing too much. And then hypo, so its counterpart would be hypo. Oh, that's terrible, hold on. So hypoventilation is breathing below normal, breathing too slow, okay? All right, any questions on any of the respiratory stuff? Okay. Also keep in mind that on Canvas, I posted some respiratory videos. Okay, if you guys want to take, each video is, gosh, probably 2 or 3 minutes, so they're not very long. It does help show some on more of a 3D, really cool animation level, how gas exchange and all that works. Okay, so next Tuesday, we will be covering, we're going to start, so the next section kind of all runs together, okay? Urinary system, digestive system, GI, gastrointestinal, okay, liver's in there, stomach, and all that, okay, it kind of all runs together. So we'll be starting that next week.